Good evening, wherever you are. This is Orion Reed from ConferenceHype. From the July 2026 edition of the New England Journal of Medicine, this is a review covering advances in multiple sclerosis. Multiple sclerosis is a chronic autoimmune disorder that affects the central nervous system, causing episodes of neurologic dysfunction and often gradual disease progression. The immune system primarily targets myelin, the protective covering of nerve fibers, leading to inflammation and damage, and secondary neurodegeneration is a major cause of long-term disability. Common symptoms include vision problems, sensory disturbances, muscle weakness, balance difficulties, and bladder dysfunction. This is a good review on the topic, well worth reading in full in this issue of the New England Journal of Medicine.
This is ConferenceHype. Stay with us, coverage continues.
From the July 2026 edition of the New England Journal of Medicine, this journal review looks at ianalumab plus eltrombopag in immune thrombocytopenia. Background: current second-line treatments for immune thrombocytopenia require long-term administration. Methods in this Phase 3 randomized double-blind trial, we assigned, in a 1:1:1 ratio, adults with primary ITP and an insufficient response or a relapse after first-line glucocorticoid therapy to receive ianalumab at a dose of 9 mg or 3 mg per kilogram of body weight or placebo once monthly for 4 months. Results: a total of 152 patients underwent randomization, 50 to the 9 mg ianalumab group, 51 to the 3 mg ianalumab group, and 51 to the placebo group. Discussion: ianalumab plus eltrombopag led to a longer time to treatment failure than placebo plus eltrombopag.
This is ConferenceHype. Stay with us, coverage continues. From the March 2026 edition of the New England Journal of Medicine, this journal review looks at angiography-derived fractional flow reserve to guide PCI.
Background: assessing intermediate coronary lesions with an intracoronary pressure wire improves clinical outcomes in patients undergoing cardiac catheterization and percutaneous coronary intervention. Methods: in this international non-inferiority trial, we randomly assigned patients undergoing coronary angiography who were found to have at least one intermediate coronary stenosis to physiological assessment, with measurements derived from angiographic images or with pressure wire-based measurements. Results: a total of 1930 patients were randomly assigned to physiological assessment with FF-Rangio or a pressure wire-based approach. Discussion: among patients with intermediate coronary artery lesions undergoing physiological assessment in the cardiac catheterization laboratory, an angiography-guided strategy involving FF-Rangio was non-inferior to a pressure wire-guided strategy with respect to a composite endpoint of death, myocardial infarction, or unplanned clinically indicated coronary revascularization at 1 year.
This is ConferenceHype. Stay with us, coverage continues.
From the March 2026 edition of the New England Journal of Medicine, this journal review looks at angiography-based physiology to guide coronary revascularization. Background: current society guidelines recommend physiological assessment of intermediate coronary lesions to guide revascularization. Methods: we conducted an international, open-label, randomized, non-inferiority trial at 37 sites in Europe. Results: the primary endpoint was assessed in 1116 patients in the VFFR group and 1095 in the FFR group. Discussion: among patients with intermediate coronary lesions, VFFR-guided revascularization was non-inferior to FFR-guided revascularization with respect to a composite of death, myocardial infarction, or revascularization at 1 year. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is ConferenceHype. Stay with us, coverage continues.
From the July 2026 edition of the New England Journal of Medicine, this journal review looks at rituximab versus ocrelizumab in newly diagnosed relapsing multiple sclerosis. Background: anti-CD20 monoclonal antibodies are effective for relapsing multiple sclerosis. Methods in this Phase 3 multicenter, double-blind, non-inferiority trial, we randomly assigned adults with newly diagnosed relapsing multiple sclerosis and recent disease activity in a 3:2 ratio to receive rituximab or ocrelizumab every 6 months for 24 months. Results: a total of 218 participants underwent randomization, 216 received treatment. Discussion: in participants with newly diagnosed relapsing multiple sclerosis and recent disease activity, rituximab was non-inferior to ocrelizumab in suppressing disease activity, as detected by MRI from 6 to 24 months, with a similar incidence of serious adverse events.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors.
Card 28. Talia Stone is covering JCO oncology practice. The topic is role of a designated pharmacist in reducing adverse drug reaction rates and preventing potential medication errors in hematology oncology, a randomized controlled trial. Background: evidence is insufficient regarding pharmacists' impact on reducing adverse drug reactions in oncology. Methods: this single-center randomized clinical trial was conducted at its outpatient hematology oncology clinics from July 2020 to October 2022. Results: the study included 182 patients, 91 in each group. Discussion: integrating an oncology pharmacist into hematology oncology clinics reduces ADRs and improves the detection and prevention of potentially serious MEs.
This is ConferenceHype. Stay with us, coverage continues.
Card 27. Grant Ivy is covering JCO oncology practice. The topic is staff perspectives on normalizing and sustaining electronic patient-reported outcomes monitoring at 6 U.S. health systems. Background: we assess the perspectives of staff from 6 health systems to understand how electronic symptom management, an ECM program that supports patients during chemotherapy and after surgery, is normalized and sustained. Methods: starting in 2019, we integrated ECM into routine clinical practice and assessed its effectiveness using a cluster randomized stepped-wedge trial results. Of the 211 staff who initiated the survey, 169 completed it. Discussion: clinical staff reported moderate levels of normalization and capacity for sustainability. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X. This is ConferenceHype. Stay with us, coverage continues. Card 26. Elena Park is covering JCO oncology practice. The topic is impact of premedication de-escalation on incidence of infusion-related reactions with daratumumab. Background: daratumumab is an anti-CD38 monoclonal antibody used to treat multiple myeloma and light chain amyloidosis. Methods: a retrospective chart review at the Mayo Clinic reviewed eligible patients with multiple myeloma or amyloid light chain amyloidosis who received their first dose of daratumumab within the 4 months preceding the date of implementation, or no more than 4 months after the date of implementation on April 13, 2022. Results: nearly all patients received daratumumab by SC route of administration. Discussion: omission of premedications after cycle 1 of daratumumab did not increase the incidence of infusion.
This is ConferenceHype. Stay with us, coverage continues. Card 25. Benji Cross is covering JCO oncology practice. The topic is timing of immunotherapy in practice, feasibility and impact of morning checkpoint inhibitor administration. Background: immune checkpoint inhibitors are a core mainstay of cancer care.
Methods: in routine practice, the time of day of administration of ICIs invariably is not stipulated in the clinical notes. Results: thus, treatment timing of administration is mainly dictated by constraints related to the organization and planning of the outpatient infusion centers, the clinical pharmacy, which reconstitutes the parenteral drugs, and the patients themselves. Discussion: a growing body of evidence, recently including a prospective randomized trial, has shown a significant halving of risk reduction of an earlier death by early rather than late to DA of ICIs in patients with 10 different advanced cancer primaries.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors.
Card 22. Amara Saul is covering JCO oncology practice. The topic is survival after fertility-sparing surgery for early-stage cervical cancer compared with non-sparing surgery, a nationwide comparative study. Background: the oncologic safety of fertility-sparing surgery in young women with early-stage cervical cancer is largely based on retrospective data from small series, highlighting the need for larger studies to validate its safety. Methods: we performed a nationwide retrospective matched cohort study of all patients, age 18-45 years, with Fédération Internationale de Gynecologie, et d'Obstétrique 2018 stage, IA1 to IB2 cervical cancer, who underwent fertility-sparing surgery, FSS. Cone biopsy, large loop excision of the transformation zone, or tricholectomy, between 2000 and 2022 in the Netherlands. Results: in total, 1,446 patients were included, 482 treated with FSS, and 964 with a hysterectomy. 57.5% had stage 1A1 or 1A2, and 42.5% had IB1 or IB2 cervical cancer. Discussion:
Women treated with FSS had a significantly higher recurrence rate than patients who had the uterus completely removed. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X. Card 23. Miles Carter is covering JCO oncology practice. The topic is racial and ethnic disparities in receipt of guideline-concordant pancreatic cancer care among older adults in the United States. Background: patients racialized as Black experience a higher mortality from pancreatic cancer. Methods: patients 65 years and older with incident PC, racialized as non-Hispanic white, or racialized as NH Black, or of Hispanic ethnicity, were identified in the SEER Medicare database from 2004 to 2019. Results of 12,772 patients included 85.5% of patients racialized as NH white, 7.8% of patients racialized as NH Black, and 6.8% of patients were of Hispanic ethnicity. Discussion: approximately half of an insured population with PC receives GCC, highlighting a need to improve multidisciplinary access and treatment.
This is Conference Hype. Stay with us, coverage continues.
Card 21. Diego Vale is covering JCO oncology practice. The topic is defining the rates of cytokine release syndrome associated with talquetamab step-up doses. Background: talquetamab is a G protein-coupled receptor class C group 5-member D T-cell engaging antibody, approved for relapsed refractory multiple myeloma. Methods: patients with RRMM who completed the talquetamab once a week or once every 2 weeks step-up dosing schedule between September 2023 and November 2024 were identified via the institutional database. Results: 50 patients completed the talquetamab step-up dosing phase during the study period. CRS occurred at a rate of 80%. Discussion: our findings suggested that the fourth talquetamab dose could be administered in outpatient settings given its high tolerability. Conference Hype. Stay with us, coverage continues. Conference Hype calls out, Sage Harlan is covering. The topic is social callout on Becker's healthcare. Background, 11 stories we are following at Becker's Healthcare have a great 4th of July. Methods, CMS targets 340B, site-neutral pay in 2027 outpatient rule, 9 things to know Allenkenden. Results, the hospitals, health systems cutting jobs in 2026 Kelly Gooch Kristen Kuchno. Discussion remains limited to the source-described topic until PubMed or full record detail is available.
This is Conference Hype. Stay with us, coverage continues.
Conference Hype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. Conference Hype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors.
This is Conference Hype. Stay with us, coverage continues.
Conference Hype calls out, Vesper Quill is covering. The topic is social callout on New England Journal of Medicine. Background, syringe anticoagulation reversal in 2026. Are we winning the bleeding battle? Methods, anticoagulant-associated bleeding remains one of the most challenging emergencies in modern medicine. Results: a new review in the New England Journal of Medicine provides an updated roadmap for reversal strategies discussion. Discussion remains limited to the source-described topic until PubMed or full record detail is available. ConferenceHype calls out, Grant Ivy is covering. The topic is social callout on JAMA. Background: Party Books Heartiest Congratulations and AMP. Best wishes. Methods: 1. Jama Masjid has launched a modern digital library with laptops, printers, and digital facilities to empower students. Results: glowing star congratulations to all discussion. Discussion remains limited to the source-described topic until PubMed or full record detail is available. From the July 2026 edition of Nature Medicine, this is a review covering immune aging biomarkers for clinical trials. Aging profoundly remodels the immune system, impairing defense, repair, and homeostatic function across tissues. Because the immune system operates in every organ, its deterioration has been proposed to drive or exacerbate systemic dysfunction and accelerate overall biological aging, making it an attractive biomarker and target for geroscience-guided trials. Despite this central role, there is no consensus on how to quantify immune aging, especially in. This is a good review on the topic, well worth reading in full in this issue of Nature Medicine.
This is ConferenceHype. Stay with us, coverage continues.
From the July 2026 edition of Nature Medicine, this journal review looks at generalizable AI predicts immunotherapy outcomes across cancers and treatments. Background: immune checkpoint inhibitors have become standard care across many cancers, but most patients do not respond. Methods: in 16 independent clinical cohorts spanning 7 cancers and 6 immune checkpoint inhibitors. Increasing precision by 8.5%, Matthews correlation coefficient by 12.3%, and area under the precision recall curve by 15.7%, with minimal or no additional training. Results: predictors such as tumor mutational burden, PD-L1 expression, and transcriptomic signatures often fail across cancer types, therapies, and clinical settings. Discussion: there is a clear need for a robust, interpretable model that captures shared immune response principles and adapts to diverse clinical contexts. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X. This is ConferenceHype. Stay with us, coverage continues.
This is ConferenceHype. Stay with us, coverage continues.